Okay, so still same language. I'm now going to talk to you about a key showpiece, but it's not all show, it's real, around information for professionals. Remember what we said we were trying to do is integrate systems, put smart stuff on top of those systems to help with decision making, and ideally use information that's collected for intelligence. The intelligence bit is the really difficult area. What we've had to do, and this is just a bit of an aside, because of permissions to share, not permissions to share, we've had to create a big line at the moment between systems for clinical use, what we call direct patient care, and systems that are for analysing things about people, etc. The line is that it's very difficult to feed one, the direct care feed the other bit at the moment. So this is about direct patient care to support professionals in Leeds. So remember our world of it's very complex. This was our starting position around about 4 years ago. So around about 4 years ago, myself, Dr. Tony Shannon, Jason, Dr. Jason Brock, realised that actually where nationally there had been endeavours to join things up, great endeavours, great intentions, got too big, couldn't localise it, we felt, shouldn't we do something in Leeds to join information up to help with our treat Bob, not treat the component parts. Now, just to draw what I want you to think in the back of your mind is the parallel between where we were 4 years ago with the Leeds Care Record and the point in time we are at with the person-held record. It's almost, we've got an idea, we think strategically it's correct with the person-held record, we know sort of what standards, but in a way it's a moment of trust and a step to say this is the right thing to do, because not everybody gets it at the moment. So just think about that in terms of our experience with the Leeds Care Record. Right. So, Leeds Care Record is a shared facility that has brought together data from the teaching hospitals, the GPs, mental health, community and social care. Just to show some Leeds pictures, so as I say, 106 GP practices, 150 sites, roughly a population of 800,000, so that's our population in Leeds. Mental health, just the image there of the Becklin Centre, which is on the St James's site. Community is health centres, district nurses, community midwives, etc. Leeds Teaching Hospitals, Jimmy's, LGI, well actually that's made up of about 8 different sites, so again it's complex geographically. Social care, again, really important part of the looking after people in Leeds. So, the journey was, 4 years ago, we believed there was a case to be made that if we joined this up for the good of the patients and the good of the professional, that this would put us in a really good position, and here we are 4 years down the line, and that has indeed been the case. Now, just to pick up on some of the things around data sharing. So, the principle in Leeds is, amongst all the clinical organisations, and we've done a lot of patient engagement, is healthcare in Leeds, if you want holistic healthcare, we will, by default, share that information amongst the professionals that need to see it. That's very different than just saying, we share your information. So the patients, the professionals that need to see it is, if you go into hospital, a hospital consultant, a hospital nurse, probably needs to see what's happened in your GP practice. If you've been to hospital, your GP most likely needs to see what's gone on in hospital. People can opt out of that, and what we did is we have made sure every statutory organisation, 106 GP practices, all signed up to the Leeds Care Record, consulted in whatever way they chose to fit for their patients around this is what we're doing. You can opt out. This is what the Leeds Care Record is. We've had patient groups, very much down the lines of what Emma was saying. People thought we did it already. What? You don't share information. Very robust in terms of all the specialist information governance officers, managers in each of the organisations, 100% behind the basis upon which we shared information for the Leeds Care Record. There is always an element of benefits versus risk, because there are far too many people that say you can't, because I'm scared that I might be told off if you do. But this is a risk-based decision. Okay. Right. So what is it? Well, the Leeds Care Record is it's an extension of what has been used in the Leeds Teaching Hospital, St James's, LGI, Seacroft, Chapel Arton, etc. Whereas, and that's one of our acronyms, PPM Plus, Patient Pathway Manager Plus, basically means next version. That's a system that was used inside Leeds Teaching Hospitals, and they've been using that for, let's say, between 5 and 8 years. So here, they would generally have only seen hospital information. What we've added is we've added 4 more tabs worth of information from each of these sectors. So it's role-based. So if you need access to the Leeds Care Record, you have to have a defined role, and your role says what you can have access to. So it will say how much, whether it's appropriate. So you can now see, or a care professional, and just as a headline statistic, we now have over 4,000 active users of the Leeds Care Record. A care professional can see hospital information, GP information, mental health information, community and adult social care. Now interestingly, for each of those tabs, let's take mental health, sensitive subject, absolutely. Becoming less, I wouldn't say less sensitive, but less of a, it's becoming very much now mainstream in terms of people accepting that that's something that many of us have. We did lots of very structured work with patient groups about what do you think, patient groups that were mental health patients, what's the line you don't want us to cross? We agreed that, signed it off, and that's now built into the system. Same with adult social care, same with community care. It's all been patient-driven, patient consulted on. We can't consult with everybody in Leeds, but that's our endeavours to consult, as I would say, has been pretty robust. So that's an individual view. That's patient, whoever it is, Bob. 4,000 practitioners can see what they need to see to make better care decisions. So if I'm in a community team and I'm looking to keep these patients out of hospital, how will this help me now that I can see more, but appropriately more? How will it help me? We've got Alex that's going to give us, we thought it was really good to get a practitioner to give us a feel for how it's used in real life. So just as an example, hospital system, GP systems, neighbourhood teams. Yeah, at its very basic, you can share that thing called electronic discharge advice notes, which is, I've been into hospital, the GP needs to know something about that. The other one that E did is actually called an E discharge initiation document, and that's something that's used with this patient is now ready to be discharged, and it's something that you'd send to social care to say there's some preparation that needs to be done to get these patients out of hospital, shared electronically. And then on the right hand side you can see summary of conditions, you can see test results, you can see letters, referrals, etc., etc. Now, this is a really interesting feature. So here, what did we have? A patient-centric view. Here's an individual. Now, this is a hospital ward, and hospitals, the hospital is moving towards, and has successfully done it in a number of wards, moved towards an electronic whiteboard. So you're probably used to going onto a ward and seeing your name, relative's name on a whiteboard with rubbed out marker pen, etc. They're now moving to electronic whiteboards. Massive culture change, because it means real-time use of systems. So it's not my job, I'm a doctor, it's not my job, I'm a nurse, etc. Real systems that need to be up to date around when were you admitted, who's your consultant, which team are you under. Interestingly, it also talks about what's preventing you from being discharged, because we want to get patients out of hospital as soon as they can be. So is it OT you're missing? Is it physio you're missing? The reason we're mentioning this is, so that's a multi-patient view in a hospital, which is, this is a ward. The GPs, using the Leeds Care Record, can, at their desk, see what's called a virtual ward of, here are my patients spread across all these hospital wards. The idea is GPs, neighbourhood teams help to pull patients out of hospital. Oh, this patient looks like it's ready for discharge. We just need to do X, Y and Z to get them out of hospital. Examples of its use, and Dr. Jason Brock here is one of our sort of key proponents and users of this. Example here, Jason was in his GP practice. Jason saw there was a patient in hospital that was a carer for another patient that wasn't in hospital. Now, what's going to happen to that patient that's the citizen needs caring for, the patient's in hospital? So that was a good example of, you can use it proactively to say, I need to do something to help this person because I now know her circumstances or his circumstances have changed. Is it making a difference? So this is we've only just done this recently, but this is, on average, the number of clicks a user makes into information that they normally wouldn't have access to. So what have we got here? So it says, so we've got April 16, March 17. So April 16, a person in hospital, on average, clicked in 11 times to GP information that they wouldn't have had access to normally. And that's now increased to 15 times. A GP clicked into mental health information from the mental health trust that they may not have had access to normally. So it's a really good example of how would they have got that information in the past. Well, one is they might not have got it. They might have said it, well, you know, I'll guess. Or they might have said, I need to make a phone call, or I need to write a letter, or I need to do something else that was very long-winded. So that you can see here about how we are starting to evidence people working smarter. So again, just a reminder, what we've talked about there is a facility now for probably 3 years into live use, started with 4 GPs and now has the whole of the city. Interestingly, it's also used in Yorkshire Ambulance Services 111 service. So you know 111, ring up, so I've got a problem, rackets, I'm ringing you because I don't want to just go down to A&E. If that's not handled in the best possible way with as much clinical information, and the Yorkshire Ambulance do say when you ring, please be aware we will be using information from elsewhere. So they've now got access to the Leeds Care Record. Oh yeah, I can see X, Y, Z, better clinical decisions. So again, this was an idea 4 years ago. It was, why can't we do something in Leeds? Massively impacted by clinical ownership. This wasn't a technology, here you go. This was done in co-production with clinicians, doctors, nurses, social workers, etc. So that's the preamble to Alex.